Good morning friends. Today we are going to discuss sinus arrhythmia. Now we know that our dominant natural and normal rhythm is a normal sinus rhythm which originates from the sinus node in the right atrium. Now even that can be arrhythmic, so that is why it is called sinus arrhythmia. That means it is little irregular. In fact, sinus arrhythmia is one of the commonest cause for referral for ECG reading in young people when they present with irregularity in their ECG. So, what it is? At the outset, let me tell you there are three types of sinus arrhythmia. One is respiratory sinus arrhythmia, another is non-respiratory sinus arrhythmia, and the third is ventriculophasic sinus arrhythmia. And today our focus is on respiratory sinus arrhythmia, which is the commonest type of sinus arrhythmia found in young adults and healthy normal individuals. Non-respiratory sinus arrhythmia is not associated with breathing pattern. So it is generally found in elderly and in patients with heart disease. Whereas ventriculophasic sinus arrhythmia occurs in the context of complete heart block. You know that in complete heart block, QRS complexes or RR interval are clock regular. But sometimes they can show a very slight irregularity, especially when there are two P waves surrounding a QRS complex. That means a QRS complex in between the two P waves. Now these P waves can be at a narrower interval as compared to the P waves which are not surrounding the QRS complex. So this is called ventriculophasic sinus arrhythmia. Now we come to respiratory sinus arrhythmia, which is a commonest type of sinus arrhythmia, and it is physiological. So it is not pathological. In fact, it is actually believed to be very good. It projects a healthy heart and a healthy autonomic nervous system of the body and a healthy vagal nervous system which is supplying the heart. Now why there are respiratory means the rhythm is becoming irregular because of changes in respiration, that means inspiration and expiration. So and how do we define actually sinus arrhythmia? That is a normal sinus rhythm which is irregular, and that irregularity is projected in the form of PP intervals or RR intervals, which are narrower at places and which are longer at places. And this distance between the PP interval is more than 3 small segments. That means 0.12 seconds. You can speak in terms of PP interval also, or we can speak in terms of RR interval also. Alright. Then how can we say that it is sinus arrhythmia? Because the P wave will be from the sinus nodes. That means when it is coming from the right atrium, it is directed down and left. So it will be upright in lead 2, it will be upright in lead 1, it will be inverted in AVR. So that is, and a biphasic in V1. So that is how we define a sinus P wave. And then this PR interval of this sinus arrhythmia will be constant. That is the point. PR interval will be constant. So in sinus arrhythmia, there is respiratory I am talking about. There is cyclical fashion. In heart rate is increased in cyclical fashion. And when the heart rate increases, when the heart rate is picked up, the PP interval will close. So like here, there is inspiration. So heart rate is increased. So RR interval and PP intervals are close. And then there is heart rate decrease. So here the heart rate has decreased during expiration. So PP interval and RR interval have lengthened, or there is a gap between the interval. So what happens in inspiration? Why it is so that the heart rate is increasing during inspiration? Just remember I. Inspiration, I. Increase in heart rate, I. And one I for inhibition of the vagal nervous system. So what happens during inspiration? When we take deep breaths, so our lungs, there are vagal receptors in the lung which get stretched, and when they are stretched in the lungs, they are actually during inspiration they are inhibited. So if the vagal nervous system is inhibited, it will increase the heart rate. And if it increases the heart rate will, the PP interval will come closer. Alright. So during inspiration, the RR interval or PP interval come closer. So this is PR. Now this, you can see that these are the two P waves here. Then this is P wave here. And now there is, and it happens towards the end of the inspiration. Now the patient has taken deep breath in and see what is happening. The PP interval from here to here, it has closed. Now it is again further prolonging because the breathing is now this is during expiration phase. Now this PP interval has increased. So this increase and decrease is by more than 3 small segments. So PP intervals are constantly changing because of the inspiration and expiration. So here you will see a close group of a group which is closer, and here you will see a group which is longer. Then again you see a group which is closer. So this is happening in cyclical fashion. And you see, oh my god, this is an irregular rhythm. But watch, every P wave is followed by a QRS at a constant PR interval. So that means the focus of the origin of P wave is constant. So sinus arrhythmia, cyclical fashion, there is increase in the heart rate and decrease in the heart rate. Thereby there is closing up of PP interval and there is lengthening of the PP interval. During inspiration, since I already told you, it is vagal is inhibited, so it will increase the heart rate. And during expiration, the opposite will happen. And the crux here is the P wave morphology is constant and PR interval is constant. That is not going to change. Now, and this occurs in normal young people, healthy people, because they have a good, well-developed autonomic nervous system. And it decreases in elder or due to heart disease or when there is disease of the autonomic nervous system, such as in diabetics. So in elderly, as it is, you know, the nervous system will be affected. So that is why this respiratory variation will not be there. And this sinus arrhythmia especially is pronounced more who exercise more, who are athletic. So they have a good vagal influence on their heart. So now what are the conditions which can increase the sinus arrhythmia? So all those vagotonic conditions which will, that means which enhance the vagal nervous system activity will increase the sinus arrhythmia, such as during sleep. This is the most physiological. During sleep, the heart rate may drop down to even 38, 35 in some people. So during sleep there is bradycardia and the vagal tone increases and sinus arrhythmia increases. Similarly, certain drugs like digoxin can enhance sinus arrhythmia. And this is sensitive carotid sinus or carotid sinus massage. If you are giving carotid sinus, you are pressing your carotid sinus, this will directly influence the vagal nervous system, enhance its activity, and therefore the sinus arrhythmia will increase. Now, certain activity will decrease the sinus arrhythmia. So, if you have a patient or if you have a person who has come to you with an irregular heart rate and a young person and you know it is sinus arrhythmia, just ask them to exercise. So, exercise is a vagolytic process. It increases the sympathetic nervous system. So, it will reduce the vagal effect and therefore sinus arrhythmia will come down and the ECG will regularize more. Similarly, atropine. Atropine is a vagolytic drug, so it will reduce the sinus arrhythmia. So this is for today, and since it's an ECG session, let me show you one ECG of sinus arrhythmia. Right? Now this is, you can see 29-year female. Here it's 29-year female. Now you can see this ECG right from here. Okay. Now this is a prolonged RR or PP interval. Now it is closing down, gradually it is coming down, here it is narrow, here it is narrow, here it is narrow, here it is okay, here it is okay, here it is okay, okay and okay. So here it was prolonged and it was narrowest here and then gradually it has again slightly prolonging. So this part was during inspiration. And this part was here, the patient had just, after the expiration, end of expiration, the patient has started breathing in. So gradually, so now you can see that there is an irregularity. But what you appreciate is P waves are constant in morphology and PR interval is constant. So you can See that PR interval is constant. Now this I have taken from the internet, this image. Here also you can see in the bottom strip. First you see that the P wave is upright in lead 1, so it's a sinus. Inverted in AVR, so it's a sinus. And then it's a biphasic in V1, so it's a sinus. It is upright in lead 2, so it's sinus. AVL upright. So we know that we have a sinus P wave, so it's a sinus rhythm. Now we see in the bottom strip that there is irregularity in the rhythm. Okay, you can see right from here till here that there is an irregularity. So here the intervals are closer, then suddenly there is prolongation. Okay, that means here is the expiration phase going on, then again there is rapid pickup of the heart rate, so there is inspiration, then again there is expiration. So this is really a pronounced sinus arrhythmia in a young person. And what you appreciate is that P waves are constant in morphology, and PR interval, whether it is slow or whether it is fast, PR interval is constant. So this is a classic case of sinus arrhythmia, and there is absolutely no need to worry. In fact, it's a healthy sign, it's a healthy heart most of the time. So stay tuned for the next session. Thank you. Jai Bharat.